Good morning. I'm Dr. George Lundberg, editor-in-chief of MedGenMed. We have a special treat for you this morning. Everyone knows the name Michael Dukakis. He served as the longest-sitting governor of the state of Massachusetts, 12 years. He ran for president of the United States in 1988, and how different the world would have been had he been elected. Governor Dukakis now serves as a professor of public policy at Northeastern University and also at UCLA. Today, he joined us in our studios in Boston to talk about health care costs, how to control them and how not to control them. Governor Dukakis.
Everybody talks about the cost of health care in the United States, and virtually everybody has a solution. In fact, we seem to be hit with a new one about once a week. First, it was HMOs and managed care. They clearly haven't done much to stop double-digit health inflation, but they have managed to add billions to the administrative overhead of the system. Then it was consumer-driven health care. I call it screw the little guy health care. But big co-pays and high deductibles won't solve the problem either. What they will do is add even more administrative cost to the system and virtually guarantee a flood of unpaid bills. More recently, we have heard about the wondrous cost-saving qualities of pay for performance and electronic records. And apart from the billions the latter will require, there isn't the slightest evidence that they will get healthcare inflation under control. Virtually all of these proposals are coming from people who tell us that if only we can create a healthcare market and people can shop around for their healthcare, all will be well. The fact of the matter is that the market doesn't work in healthcare. It never has and it never will, for reasons that should be obvious to anybody who has taken the time to study the subject. In the meantime, those advanced industrialized countries with whom we like to compare ourselves don't spend any time indulging themselves in the notion that the market can work in healthcare. And they seem to provide pretty good medical care at half the price we do, with better health outcomes. How do they do it? They treat healthcare as a public utility, and they regulate its prices. And they do it with a fraction of the administrative overhead and bureaucracy that plague our system. So maybe it's time to show the health marketeers the door and get serious about universal coverage in this country with cost controls that are reasonable, fair, and effective. If we don't, I believe we are doomed to massive increases in health costs as far as the eye can see. That's my opinion. I'm Mike Dukakis, the former governor of Massachusetts.